Right. I mean, there are physical things that go along with that insecurity as well. You know, you're sweating, you're itching, you're
if you're
nauseous.
in a sense of, right, if you're in your sense of panic, you know, there's just a panic disorder per se under the anxiety. You know, someone who's suffering a panic attack feels like they're having a heart attack. There's shortness of breath. There's the sweaty, clammy feeling. They have to get out of the situation that they're in. Sometimes they're paralyzed with that fear and they can't move. And then, you know, they could even pass out. That's the severity of the physical response to anxiety and panic. Depression can do the same thing. They can isolate themselves and end up in bed for days, not being able to wash themselves, not being able to get up and do the daily chores around the house, and certainly not being able to work or function in school.
How do parents connect with what their children are going through when they have a coexisting disorder?
Now, who has the coexisting disorder? The child.
The parents are
Okay.
trying to deal with it when it first occurs. I mean, how do they develop a sense of understanding and start to develop some skills at moving it forward in a positive way?
Definitely seeking out help, you know, finding some counseling for the child. If they sense that the child is struggling with maybe their ability to get up in the morning and go to school, then they should be seeking out counseling for the child.
So this isn't something to hide within the family as a little secret to be covered up under a blanket, but instead the parents need to bring in professionals
Right,
to
absolutely.
assist. Is this one of those things where the earlier you get the help, the better the outcome?
I believe so. You know, that secret can be passed from generation to generation, and that's what I tend to see. Our folks that have had, you know, their families and the families before them, you know, it was very secretive and not talking about anxiety, not talking about depression, not talking about alcoholism or drug abuse, which is really used in order to soothe themselves when they're experiencing all that anxiety and panic and depression. They want to change the way they feel.
I realize that there are many different combinations of coexisting disorders, maybe 40 or 60 or 80. Give me the 5 most common.
Probably alcohol and substance abuse along with anxiety and depression.
Alcohol abuse or substance abuse combined with
anxiety and depression.
Anxiety and depression.
Bipolar diagnosis is often linked with gambling addiction.
Bipolar with gambling. What's bipolar?
Well, bipolar is defined as someone who goes through episodes of mania, which is usually defined as having a very entitled sense of life. They feel really good. It's almost like feeling better than life, okay? There's usually obsessive compulsive behaviors that go along with that, such as gambling, shoplifting, or overspending. A lot of shopping behaviors, blowing all the money, and really feeling good. There can be irritability with that, insomnia with that, and usually that period lasts for about 2 weeks or more, followed by a period of almost kind of a normalcy, and then there's followed by a depressive symptoms episode where there's 2 weeks of depressive symptoms, and that could last for months. A lot of folks
up, down.
Up, down.
So it's like a pole, 2 ends of a pole, high, and this one's low.
Right.
Either way.
Right.
Yeah.
And they switch, you know, and it can be seasonally related too.
What's another common coexisting disorder?
Well, I think that the eating disorders along with anxiety. That's, okay. I think that, you know, the obsessive compulsive, you know, you see that kind of, like you said, talked about the ritualistic behavior a little bit that kind of goes along with that.
15 or 20 years ago, medical professionals didn't formally approach disease as coexisting disorders. That's a fairly relatively new phenomenon,
yes,
which brought some real benefits. Talk about how it was that there was a perception that the two together needed to be looked at in combination.
I think the relationship, like I explained, when someone has anxiety and depression and they're looking in order to change the way that feels, and then they start picking up another behavior such as drinking every day, and it works for them. So based on the fact that it's working for them, it leads to another disorder. You know, the fact that people are looking at the two together is going to be the most popular and most efficient way to treat. You can treat the mental health, but if you don't take a look at that addictive behavior and how it plays into the fact that they have anxiety and depression and vice versa, that, you know, you're not going to be successful with treatment and abstinence.
And I also think that as more and more research is done, we're recognizing as a system a physical and behavioral health care system, that these things are connected and they're interrelated. That years ago there were silos that people were being treated in. It's, you know, we are now smart enough and technologically aware to be able to know that it's one person that we're treating that has these different challenges. And why would you send somebody with a substance abuse problem over here and a mental health problem over here? We're dealing with a whole person,
and
a
there's
whole
also
family.
the benefit then that the treatment professional is looking across several different lines at the same time and understanding how the different treatments can work together or not to help that individual. So that's an important part too. Let's talk a little bit about, I can picture that having a coexisting disorder could feel like a dark place to somebody. What are the mechanisms by which, with help, that person can move forward in a positive way? What does the journey look like for recovery?
I think they have to ask and identify that they have to ask for help. They have to identify that they're struggling with something in their life.
Recognize you have a problem.
Okay. We start off, you know, we do a basic assessment. It's a biopsychosocial. We ask questions and get their history. And then we're looking at what type of symptoms they're dealing with and getting a diagnosis. Trying to help the client help themselves, okay? Showing them their strengths and that they don't have to focus on their weaknesses, that they're actually a survivor of maybe the past traumatic events that have led to where they've become. And sometimes just normalizing, you know, their lives a little bit, that it makes sense that they would be trying to use drugs and alcohol or gambling or shopping or whatever to change the way they feel.
I think there's also societal changes that need to continue to evolve and take place. That there's a huge stigma around behavioral health care issues, substance abuse, alcohol, anxiety, depression. Again, it's a disease.
What's the stigma?
The stigma is, oh, you're crazy, or you're not good enough.
Or booga booga.
Or,
just, it's that whole booga booga thing. Like, I don't want to look at it, I don't want to deal with it, it makes me uncomfortable. Booga booga. You
know, in behavioral health care, there is a hierarchy. Which would you rather have? Would you rather be, you know, bipolar or an intravenous drug user? Would you rather have an eating disorder or a gambling problem? I mean, there's a hierarchy. And everybody would rather have heart disease than a mental health disease. I mean, think about it. So, especially when you're dealing, I think, with children who are exhibiting these kinds of signs of trauma, you know, kids have to be assured that they're going to be okay, that things will work out, this is a bump in the road, and chances are that parent had the same challenges. These things just don't appear magically.
Because it is genetic.
It is genetic. A lot of it is genetic. So, you know, the trick is getting to the parents to recognize that they also have a challenge and then watch for the signs with children.
Thanks to Jewish Family Service for their help in providing these shows today. Very interesting topic and food for thought. Thanks so much for joining us on Medical Matters. We'll see you again soon. For more Medical Matters television shows, go online to medicalmatters.tv.